Hi, this is Module 8 assignment for our Research Evidence-Based Practice class. And to begin, hi all, today I'm going to speak more about the clinical problem, does the rate of infection decrease when nurses follow the correct procedures and standards of care? Now this is a very broad topic in nursing and can be applied to many different procedures and standards of care. One would first start off with the simple idea of hand washing. Obviously, if any of you have been in a hospital setting, you would understand that there is a sink, hand soap, and a hand soap in every hospital room, along with hand sanitizer dispensers. It goes to show the importance of hand hygiene and how much a difference of simply washing your hands can make. Proper hand hygiene decreases the proliferation of microorganisms, thus reducing infection risk, healthcare costs, and length of stay. The CDC mentions that proper hand hygiene is the single most important practice in the reduction of the transmission of infection in healthcare settings. Just take into account the simple ideology of a hospital. It is a place where sick people go to receive treatment. Now imagine a place with a bunch of sick people and healthy people. If infection is not controlled, then infection will spread. What is one way to reduce the spread of that infection? Well, I believe the most important way would be to utilize proper hand washing technique, and not only technique, but also knowing when to practice hand hygiene. Being in the hospital myself as a nursing student, following a nurse, I've been practicing hand hygiene every time before I enter a room and after I exit a patient's room and in between. To give a little background on hand washing practicing began in the 19th century. Over the years, the practice of hand washing has evolved through evidence that hand washing does in fact reduce the transmission of pathogens. Contaminated hands of healthcare workers are a primary source of pathogenic spread of infection. Taking a closer look at the skin itself, it presents outer superficial layer known as the stratum corneum, the epidermis, dermis, and hypodermis. Healthy skin, which most human beings have, is colonized with resident flora. These are microorganisms that live below the stratum corneum and the skin surface. The flora competes for nutrients and is a microbial antagonist. These bacteria are not pathogenic on intact skin, however, making contact with non-intact skin, eyes, or sterile body cavities can lead to infection. These transient microorganisms can be transferred from patients to healthcare workers through direct contact, close contact with patients, contaminated objects, or contaminated environmental services. Now, imagine a scenario where you are a nurse treating a patient. You enter the room. That patient is currently on droplet precautions dealing with a strain of influenza. It would be vastly important to wash hands both before and immediately after exiting the room to avoid spreading those transient microorganisms to another patient you are taking care of in the next room. Imagine touching a surface that was contaminated with the influenza virus. That virus is now on the superficial surface of your skin. Not properly practicing hand hygiene once leaving that room, those microorganisms are living on your hand and awaiting to be transferred to the patient in the next room when you touch something or them with your hands. In 2009, the World Health Organization spread the importance of hand hygiene through the 5 moments for hand hygiene. These 5 moments include before touching or coming into contact with a patient, before performing a clean or aseptic procedure, after an exposure risk to bodily fluid and glove removal, after contact with a patient and their surroundings, and after touching an intimate object in a patient's immediate surroundings. Moving on from hand hygiene, I wanted to bring up more of an in-depth look at an actual pathogen that is known to be a common HAI, or in other words, a healthcare-associated infection, and relates to my clinical question of, again, does the rate of infection decrease when nurses follow the correct procedures and standards of care? That topic would be involving CAUCHI, also known as catheter-associated urinary tract infection. Is there a way for nurses to follow correct procedures and standards of care involving catheter to limit the amount of infections that transpire? In short, yes. 9% of all hospital-acquired infections are CAUCHI, or better known as catheter-associated urinary tract infections. It is believed that 65 to 70% of all CAUCHIs can be prevented. The keyword prevented shows that through research, There are ways in which 65 to 70% of these infections can be prevented through proper procedures and standards of care. A study in which I want to focus on involved the Boston Medical Center, where there were a total of 53 CASHIs in 2013. Through implementation of healthcare improvement guidelines and healthcare infection control practices known as the processes for insertion and maintenance of Foley catheters, indications of indwelling Foley catheters, appropriate testing for CASHIs, alternatives to indwelling devices, and improved sterilization techniques, by 2017 that number had decreased to 9 total cases of CASHI. So I don't know if you caught that, but the last note of practice was sterilization techniques, which most notably also involved hand washing, like talked about previously in this discussion. Now, in my practice environment, I will utilize the information and research I just presented to you. I will utilize that vital information to garner the appropriate hand washing techniques, the appropriate times when to practice hand washing, and most importantly, ensure the correct technique is being utilized to remove those bacterial pathogens from the surface of the hands to prevent the spread of infection. I will also use the information surrounding CASHIs, which I just presented to you, to develop procedures similar to just as effective to not only preventing CASHIs, but other common HIs as well, such as central line-associated bloodstream infections, surgical site infections, ventilary-associated pneumonia, etc. I will develop proper procedures involving aseptic techniques, safe insertion and maintenance of said procedures, and an overall clean and safe environment in my practice. Nightingale's theory and account of working as a nurse during wartime. I want to talk a little bit more about that. She got to see what soldiers faced and the condition in which they were treated. Nightingale observed a direct correlation between the sanitary conditions of the patients and their health and recovery, which more clearly meant patients whose sanitary condition was poor often faced other health issues as well, such as further spread of infection. That is the theory I'm relying on in this discussion today, is that providing a clean environment, following correct procedures, and practicing proper sanitation technique will lead to a safer, healthier workplace that will not enable the spread of infection or prevent it. Like earlier mentioned, I noted the internal evidence of the study which occurred at the Boston Medical Center and how, through implementation of improved practices and protocols, that infection rates were able to decrease by a drastic 83%, from 53 CASHIs in 2013 down to 9 CASHIs in 2017. I will evaluate outcomes from my change project by implementing an ongoing study that will produce the current results of infection rate, infection spread, as well as overall patient outcomes each month. Utilizing that data, I will come to conclusions whether current procedures need to be changed or procedures should be kept the same. That goes as well to education to the employees, making sure they're up to date in all their procedures and practices they're implementing. For example, if an infection rate shows to be of lesser decline in using a certain antibacterial soap over another after changing to a new formula, then obviously the antibacterial soap that proved more effective in fighting infections will be implemented into the practice. Another example, if a procedure of removing a skin biopsy involves both procedures of a shave biopsy or a punch biopsy, an ongoing study within the practice can determine out of 50 of each procedure which technique led to a better patient outcome. My practice will involve all areas of healthcare, from simple rehydrating factors to full-blown surgeries. I intend to have the most innovative, up-to-date practice that incorporates all types of evidence-based practice and continually will evolve through evidence-based practice and in-house studies. All in all, my practice will continually evolve based on the current practices, up-to-date procedures, and sterilization techniques, and will always continue to improve those procedures and sterilization techniques to offer safer, better patient outcomes and refrain from further spread of infection. Thank you.